There are many ways to remove benign moles, and the use of AC electrical arc is one of them. Like aesthetic lasers, voltaic arc, also referred to as plasma, allows easy removal of benign birthmarks and moles. If the mole is removed properly, and the aftercare is followed, the risks of scarring are very low. However, a minor likelihood of scarring exists despite the method used and cannot be completely ruled out. This type of procedure can be performed by a healthcare professional as well as a beautician or any other appropriately trained non-medical person, as long as the mole is benign and removed for cosmetic reasons only. There are several types of benign growths, which are referred to as benign moles. As a general rule, in order to minimize the risks of scarring, it is recommended that the mole removed is leveled off with the surrounding skin area. Certain particular types of benign moles may be rooted between the dermis and the epidermis, and may require a specific technique to remove them in one session only. Having the knowledge of the type of benign lesion you're dealing with will help you in the effective removal of the benign lesion in a single session. If the benign lesion is rooted between the dermis and the epidermis, a slight deeper ablation or burn may be required to remove the lesion in one session only. If these more deeply rooted moles are leveled off with the surrounding skin area, multiple sessions may be required to remove them effectively. The technique used for benign moles removal is the spray operation. Generally, moles can be effectively and quickly removed by burning them off using AC electric arc, by starting from the top and working all the way down to level them off with the surrounding skin area. Particularly thick moles may be better removed with the device set at maximum power level in order to remove the bulk of the mole effectively within a reasonable time frame. Normally, experienced users set the device at top power level to coarsely remove the main bulk of the thick mole. However, when you first start using the device, it is advisable to apply the arc at minimum power level or generally low power settings in order to gain confidence with this type of procedure. Also, if you're a first-time user of AC electrical arc, after every voltaic arc short spray, wipe the carbon residues away by using a cotton pad impregnated with non-flammable antiseptic to clear the carbon residues. This will allow you to get used to the amount of mole ablation possible with the device set at a predetermined power level. When the carbon residues are cleared, you can see the level you have reached in the mole removal process. You can also feel the remainder of the mole to be removed by running the tip of your finger on the mole you are removing. As long as you feel a small bump, this means that you still have some work to do to level it off. Start reducing the power level of the device to the minimum setting when, after touching the mole, you feel that the bump is very thin and you're just about to level off the mole with the surrounding skin area. This is because reducing the power level will allow you a higher degree of accuracy in the ablation of the mole. The lower the power level, the higher the degree of precision you will be able to operate with. When removing small and thin moles, low power levels may suffice to remove small moles quickly. If you suspect a mole is thin, it is advisable ablating the mole by using the lowest power level. You may also find that for small, thin moles, a short spraying on top of the mole will suffice to remove them. Always wipe off the carbon residues after every burst, especially the first time you start removing moles using voltaic arcs. So to recap, make sure that the mole your client intends to have removed is a benign growth. Explain the content of the consent form and have it signed by the client. Explain that there are no guarantees that a scar may not replace the mole after removal. Take before pictures of the moles and store them electronically. They will turn out to be useful in the future. Apply numbing cream on the mole. Follow the instructions of the numbing cream supplier. Once the area is numb, wipe the cream residues away and start removing the mole. In case of particularly thick moles, and if you are an experienced user, start burning the top of the mole with the equipment set at top power level to remove the bulk of the mole within a convenient time frame. Wipe off the carbon residues after each burst to appreciate the level you have reached in the mole removal process. Repeat the process until you have almost reached the surrounding skin level. When you are close enough, reduce the power level to increase the level precision of the ablation in order to level off the remainder of the mole with the surrounding skin. For thin moles, use the device set at minimum power and wipe off the carbon residues after each burst. You may find that in some cases the thin mole is completely wiped off after a short spray burst at minimum power. Apply the appropriate soothing product and antiseptic immediately after the removal is complete. Emphasizing its importance, hand out the appropriate aftercare information sheet to the client. Explicitly instruct the client not to expose the area to potential infections. Instruct the client to use sunscreen and avoid direct sun exposure for up to 2 months after the treatment. If you want to watch examples of how moles are removed by using AC electric arc, please refer to the many videos on mole removal in our channel. We hope you found this video useful. Thank you for watching.